Oh, thanks. So I'm Joe Ketcherside. ILÚM Health Solutions. We're kind of on the tail end of being a startup, and I'll talk just a little about that after the main part of this. But as you heard, we're a precision medicine company that focuses on, and I'm going to talk about a specific thing that we're doing. Oh, just closer. Oh, yeah, okay. Say I got a green light. I know it's all right. What we're working on here in New York is kind of a particularly horrible thing. So it's antimicrobial resistance. The problem we have is basically superbugs are eating America. You guys have read about it. The fungus that nothing can kill. The things called carbapenem-resistant Enterobacteriaceae. Basically, it means that the really good antibiotics we have still don't work. The CDC says this is a nationwide crisis. 2 million infections a year, 23,000 people dying, billions of dollars in excess cost. So here in New York, that number of cases of Candida auris, this super yeast, that's half the cases in the whole country, and they're just here in New York. So how does that come about? Well, when you look at how a city's laid out, you got a hospital here, you got a hospital over there, you got long-term care, you got nursing homes. People come in and out of hospitals. They go back and forth from a nursing home to a hospital. And when you find one of these horrible bacteria, you're supposed to tell the Department of Health, you're supposed to isolate the patient. There's a bunch of ways you're supposed to manage this, but people are busy. They don't always get it done. So what happens in reality is patients go from a hospital, then they go to the long-term care, then they go to a nursing home, and they drag this bacteria with them from place to place. Even if your hospital has a really good infection control program, they may pick up on this when you come in the hospital, but when you show up at the next place, that's lost. And so the ideal is a coordinated approach. If you had a way that you could gather the data from all of these hospitals, all these different places the patients show up, tracking all the different labs, and as soon as there's an infection, or if there's a group of these, like an outbreak, you're able to identify that. You're able to tell the hospitals, you're able to tell the Department of Health. That's something that the state of New York would love to have. And sure enough, that's what we're building. So it's called New York Leads, the Laboratory-Based Epidemiology and Disease Service. It sounds kind of simple. Basically, it's identify these patients with the super resistance, detect an outbreak, meaning like I got 5 or 6 here in one place because it's spread, be able to communicate that information to the Department of Health and to be able to tell the providers, hey, this is something happening, you need to address it. And then the ability to track molecular diagnostics to actually identify the genes in some of these bugs to be able to identify new resistance mechanisms. So that's what we're doing. This is a partnership between us, the Department of Health, Wadsworth Reference Lab, which is here in Albany, and a company called Opgen, which does the molecular diagnostic part. So we're about 7 months into our first year, and this is a demonstration project, and it's just a rough architecture, basically building in some of our acute care tools where we already work within hospitals, and then to be able to overlay that with an entire surveillance system. So we've got pipelines going in from each hospital, and then we can see everything happening statewide. So far what we've done is we've built these data pipelines. We've got kind of a view of the patients that have the infections, and then updates into some of our core decision support tools. So we're getting like a nasty bug a day from Wadsworth. We're getting over 600,000 encounters, 400,000 patients, 17,000 micro, and that's just from NYU. The next things we're doing is building things out for Northwell, which is another part of the health system we're working with, building in the surveillance databases, and the things left to do are to build out some of the last bits of the UI and build the cluster detection. But that's a first year project, and we're well on the way for that, and we finished that in March. So why am I here? Well, we got next year coming. Next year is going to be where we extend and expand. Basically, it's more bugs, it's more hospitals. It'll be most of New York, which it turns out, or most of New York City, which is over half the population of the state. For us to do that, we're going to need a lot more people. And in particular, we're going to need a lot of people around our implementation teams. And so that's the ask of the community, is to help us find. We're going to need another project manager, data integration specialist, a data scientist, someone who can do machine learning tools, a clinician like an epidemiologist or an ID physician who can work with us, infrastructure support, frontline support. And the team is based here in Albany. We're at the Bull Moose Club, although we do have very flexible hours. So just a quick thing to note about this, I mentioned at the beginning that we're kind of toward the tail end of the startup. ILÚM itself is a wholly owned subsidiary. Well, not really a subsidiary. We're a small company that was spinning out of Merck. So you know the big, so yes, I work for a drug dealer. What can I say? An international drug dealer. But 6 years ago, ILÚM was spun out as entrepreneurship from kind of a little skunk works with some people who had global experience at antibiotic development and stewardship. In the meantime, a group of us, myself included, serial entrepreneurs who'd started several companies in the public health, infectious disease, and health IT space, started our own company. Well, within the first year the two of us discovered each other, we spent about 4 years doing joint development. But you know, we always had a few of our own separate things we were working on. And then 2 years ago, ILÚM just went ahead and acquired TECA. And suddenly, everybody in the boat's rowing in the same direction. But it's resulted in a really exciting culture because you have a combination of people with a global big company experience and a bunch of fairly fearless, I guess I could say fairly inappropriate, smart people working on really fun projects. We make tools to work within hospitals. We make things that are designed to help physicians provide better care. We have international tools we created. I spent a year and a half working in Cali, Colombia, yes, as an international drug dealer. That went over well at Customs, let me tell you. And now we got this great opportunity here in New York. So here's a bunch of us in our team and a reminder of those jobs that we're going to have starting in March. And so we're starting to look for people now. And there's my contact information. Take a picture, write it down, let me know. Questions?
Well, what about the bugs that are floating around in the hospital and you go for one thing and you end up getting stabbed?
Yeah, see, that's exactly the kind of thing that we're targeting, because one of the ways that happens is a patient comes into the hospital and they don't realize that they've had an infection. That patient may be a carrier or colonized, and so they can come into the hospital, spread that around, and nobody realizes it till the next person gets sick. So one of the things that by connecting all the hospitals together, when a patient comes into the hospital and they had an infection last month or the month before, we will tell the hospital right then, yeah, I know this guy looks fine, but you need to check him, you need to swab them, you need to see whether they have an infection. And the whole purpose of that is to keep that from happening by intervening early. And that's the problem, is it's so scattered right now, people don't know where those infections are. So we hope to make a significant improvement in that.
Joe, how's this work been funded today? How's it been funded today?
This is, it's a combination. There's some economic development funds and then some Department of Health funds. Yeah, so it's basically state funded. Yeah. And I should mention the state has really, really good, they already have syndromic surveillance, they have reportable disease requirements, there's environmental monitoring. There's a whole bunch of different public health things that have been grown over decades. The particular gap they had was these multi-drug resistant organisms, because they didn't fit into any of the other things. So it's like there was this one gap that things were falling through. And so this really is just an extension to be able to fill that gap in what otherwise, and I'm not from New York, I got to tell you, I'm very impressed. All the things I've learned New York City and New York State have got great systems in place to track. This was the gap that they're filling.